Welcome to Partners in Health and Biz with your host, Wendy Meyeroff. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at pihradio.net. Call into the studio with your questions and comments, 347-945-7433. And now, broadcasting from the Partners in Health and Biz studio, here's Wendy.
Hi folks, and thanks indeed to my colleague and partner Gail Dixon for introducing me once again as the business partner in Partners in Health and Biz. So, I want to thank you all for tuning in again and tell you that today's episode is about mental health in seniors, what I also call the hidden health issue. It's very, very sad with an aging population, and I understand everybody is listening, but I'm specifically even more addressing those who are the professional caregivers of our aging population. That's adults 65 and older, although in some places we're also talking ages 50, 55, and then getting older. For a quick second, I want to send condolences again. I don't know when this will be heard because we're pre-recording, but just a reminder about, as we talk about mental health, even though we're talking seniors, whether it's a senior, whether it's a foreigner, whoever it is for whatever reason, when they kill our journalists, of course, I have to sympathize as someone who's been a journalist for over 20 years. So I send best wishes and care to everyone who's been put at risk and is still at risk every single day, and of course their families. Anyway, back to the mental health issue in seniors. This show is pre-recorded, so the way you can get more information, I even have PowerPoint slides that I can send you, but you might really want the nifty, quick infographic that I've designed. I'll tell you more about it in a minute. So whether you want any other type of information you can see yourself, whether you have questions that you'd like us to try and answer about Partners in Health and Biz, how to get on and be a guest, how to be a sponsor, I'll tell you more about it, about how you get in touch with me and or Gail Dixon as we get to the end of the show. So, back to mental health in seniors, and let me give you the scary general insights into what's happening with our older adults. Okay, 1 in 4 of them experience some kind of mental health issues, according to the National Council on Aging. That includes depression, dementia, and anxiety. Now, where does all this come from? Especially things like depression. Let's talk depression a little bit more, and I will give you even more data in a second. But just think about all the physical issues that develop as adults age in this country. And remember, I'm talking to our health professionals, the primary care practitioners and the geriatric specialists, the nurses. Well, I don't have to give you the list. And I'm also including folks like the clergy, social workers, and so forth. Physical issues, I'm sure you know, but you have to burn it into your brain that physical issues like stroke, heart conditions, cancer, and arthritis can lead to mental health issues, especially things like depression. I remember seeing a study, I have it filed in fact, when I was working with Erickson Retirement Communities. They were talking about depression in quote-unquote old age, and that was age 60 to 74 in this particular area. A lot of us, as I've been reporting, as I say, 20 plus years as I'm headed into Medicare. I haven't gotten there yet, but when they say 74 is part of old age, and I hate it when they say the elderly, that gets very frightening. But however we phrase it, that's a whole other statement. Check the lay language stories Gail and I did early in 2018, around the middle of the year, I would say. ages 60 to 74 says depression can cause a stroke. And then it follows up saying, okay, let's say you've had the stroke. Maybe it came from some other reason besides depression, but it's very common in anywhere from 25 to even 50% of the patients having a stroke end up with depression. And 1 in 3 stroke sufferers remain depressed a year later. And again, this is just for stroke patients. This doesn't cover heart issues and neuro issues like developing Alzheimer's and Parkinson's disease. Another thing that can cause mental health in our aging adults is having to leave home. And it can be a fun reason. They leave home, they've finally retired, bought their dream home, and they're looking forward to it, but still, leaving the neighborhood they've been in it for 20, 30, or whatever years, not maybe going to see a lot of friends and family the way they used to. The whole issue of just packing up. I moved in 2017, the end of that year, and I got to tell you, the first half of 2018, I thought I'd go bananas. So that alone can get you screwy, right? But if you have to leave home and it's not for reasons you really want to, where you have to start admitting, oh, I don't walk as well, I can't reach, I can't keep climbing up and down steps, I want a complex, and there is talk, and I would have to find it for you, but I just read on LinkedIn information about the whole concept of apartment living. Yo, this Brooklyn girl grew up with apartments. They don't know it so well in Baltimore and any other areas, certainly not in the rural areas. So we don't have enough complexes that are easy for people to get up and down in. So living in assisted living is not something they're looking forward to, or moving in with the family. Some people think this is great. Some people don't want to do it, and their families don't want them, and that causes Lord knows what mental health issues. One of the mental health issues the latter can cause is anorexia. People use this. This is not anorexia nervosa. I wrote this many years ago when I was the health columnist for Senior Wire News Syndicate, and it spread all over the place. Senior Wire was also one of the first to put stuff up on the net, and that's another way this got read. Anorexia in seniors is not the anorexia nervosa that we think of with young people, but it is a different kind of not eating. Sometimes it's because you can't stand the stuff. As people get older and older, they are not eating because stuff is bland. Taking out the salt, taking out the sugar. Heck, in many places they take out all sorts of wonderful spices that you can put in place of salt and even pepper. Cumin and coriander and rosemary and Lord knows what else. Nope, goes out the window. So who wants to eat when it's just a mess of stuff? Sometimes, though, older residents of assisted living in other places, even if they move in with the family, they're using it as their protest. I don't want to be here. So if it means starving myself, that's what I'm going to do. You can call that depression, you can call that anxiety, you can call it fear, whatever kind of mental health issue. Who knows what it gets designated under? You guys know, the folks who are listening, who are the professionals that I said, the Partners in Health and Biz site or insights are going towards. But of course, any of you listening, you have to understand these issues. Now, to give you a little bit more about depression, if you weren't worried enough, we have studies that show of adults age 65 and older, even though that market is only 13% of our population yet, and we all know it's growing, but it's only 13% of the population, 20% of that population commits suicides. They're the suicide number, 25% of all that happens in this country. That's according to Mental Health America. And it's not just the quote-unquote youngsters the 50, 55, 65, we very often ignore the older adults out there. 85%, according to, again, Mental Health America, 85% have nearly 6 times the overall suicide rate in the U.S. We forget the issue of bereavement and how it causes depression. Now, the original number, yes, is very obvious. 1/3 of widows and widowers, the first month after a loved one's death, they're depressed. But what to me is the key issue, half of those widows and widowers stay depressed 1 year later. So this is just certain types of depression and certain stats. Then there's an issue that's come up very much, addictions, especially opioid addictions. I hope folks tuned in to the earlier recording, the earlier show. I had a great guest from a Rockville group where we were talking about mobile apps and trying to help track certain prescriptions, because opioid deaths in adults age 55 and older in the U.S., sit down folks, has more than doubled in less than 10 years. I say this again. Opioid deaths in adults age 55 and older in the U.S. has more than doubled in less than 10 years. Now, most adults age 65 and older, I need to remind you, are already on multiple medications. Every time I've written about prescription drugs in this country, I have to, for older adults, I have to put in a note that, hey, the average senior, quote unquote, is on, let's say, 5 medications all the time. So, start adding it together. Your medicine for your blood pressure, your high blood pressure, for your cholesterol level, for diabetes. Those are the first 3 right there, and then you can start adding in other things to help your arthritis, a chronic painkiller like Lyrica that's not an opioid, but it's still every day in your life. And you start going off from there. So you take those people, and we do not have the communications we truly need between our health professionals. I'm sorry, I've been writing this for 20-something years, and what I find out is Dr. A is over at XYZ facility, and he gives Mrs. McGillicuddy her prescription for her fibromyalgia painkiller, and but Dr. B over at the other place doesn't know she's taking that painkiller. Maybe he prescribes an even different one, or he just ignores dumping it on top of some other medicines. That's not double checking. And who knows what interactions we could be having. And then, to get it even worse, as patients get older, a Canadian study showed that in adults age 81 and older who were using opioids, it doesn't say for whatever reason, but they're using opioids, those adults are nearly 2.5 times more likely to experience bad falls, not surprisingly, especially if they've already got knee problems, back problems, hip problems. We know as we get older, these keep cropping up. If you are fit, then you've got more knee pain as you get older. If you weren't fit and got obese, you've got more knee pain as you get older. It's like there's no good way around this. And even if you had the surgery, it doesn't always help, or sometimes you're not applicable for the surgery. Your patients are not applicable. So I don't know about here in the States, but in Canada, apparently they would use opioids, and I'm sure we do here too. I know we do here too. So if you have those patients 81 and older using opioids, the study found they're nearly 2.5 times more likely to experience bad falls. And through those bad falls, they develop all sorts of serious injuries. If they hadn't broken a hip before, maybe now's the time it happens. And unfortunately, and I'm sure you won't be surprised, those opioids and the bad falls can even lead to death in